Hey everybody, how are you? This is Sam. I want to start off with thanking everybody for all the surgery prayers and well wishes into my hip revision surgery. Sincerely, thank you for all the well wishes. Unfortunately, the surgery didn't go well. Well, actually, no. Unfortunately, the surgery has to be canceled because there was some unfortunate thing that happened. It came down suddenly before I went into the surgical room. Just doing all the preparations, suddenly I came on with a major rush of chest pain, kind of like mostly on the right side, and kind of radiated a little bit to the left. So got the doctors a little bit concerned. Uh, it came in. It came in like a wave. It went from almost nothing. I can feel something was coming on, and suddenly, just over like a couple of minutes, it elevated into something very severe. And I was under the influence of some drugs that was making me kind of drowsy, and I can felt that it was pretty painful. So that was pretty tough. So that pain kind of came in, I think in a wave of like 3 or 4 times. It went pretty high, pretty painful, and then gradually subsided to almost no pain, and then it suddenly comes back again. I believe it's like 3 or 4 times before actually completely gone away. And then the surgeon, as well as the internal medicine doctor and the anesthesia doctor, they decided to call it off because they said it was not safe. They don't know what's the cause of it. So right after, what they did is they ran some EKG, X-ray, they drawn some blood tests. EKG came back perfectly fine. The blood test comes back perfectly fine as well. Now they were expecting some number, of course, if I'm having a heart issue, I will show on the EKG as well as on the blood test. But all the number, they were expecting to see those high numbers. It comes back normal, so my blood test was normal, as well as the chest X-ray, and it was actually clear. My lungs was clear. There was nothing on the heart or nothing else that was showing that there was some issue, but I don't know what caused the particular chest pain that was just brought on suddenly. Now, prior to surgery, when they set me up with the IVs and all that, they gave me a bunch of medications. A couple of Tylenol, some Protonics to help with the stomach, and there was some other one, I forgot what it is. Also, they gave me a 2 shots of something. Well, I know one of them was fentanyl. Yeah, one of those street drugs that everybody likes, and I'll come back to it and later. I don't know why people wants this drug, because it makes me feel pretty crappy. I don't know why people wants it in the illegal market anyway. So and there was some other drug that kind of puts me to relaxation. So, and then on top of that, there was another antibiotic that they need to start. So there was a lot of medication that I had to take before the surgery, and I think it's pretty much like a standard, with pain medication, make sure that I would probably have less pain. So there was a lot of medication that kind of came into my body, and I don't know if it's one of the medication that caused the chest pain or not. And then on top of that, they applied a shot of nerve blocks onto my groin. But not only I didn't feel the nerve block. Now technically with the nerve block, they should block the leg or the surgical area to pretty numb. But not only I didn't feel the effects of the nerve block. So my hip, or my whole full leg, was supposed to be operated on my hip. Even if I pinch myself, I can still feel the pain. So I don't know if it's actually the nerve block that was caused the chest pain or not, because that was the last thing that was injected into me, and then right after the nerve block was put on, that's when the chest pain kind of came up. So yeah, I don't know. Yeah, so I'm just pretty bummed and pretty frustrated that the surgery didn't go on as smooth as I thought it would be. But I know everybody wants to be on the safe side. It's better to be safe than sorry. But it is frustrating that I was all prepared and getting ready to get a move on, and I got to get my hip revision, and I still need to get it done because you know, as I mentioned in my many videos, I had my hips replaced, both sides, done 27 years ago, and the particular part that's in there, the plastic part that's inside my body, is starting to worn out. So I got to get that replaced. And as much as I'm trying to keep myself with a positive mind, I'm actually out here walking since I didn't go through with the surgery. As much as I trying to keep a positive attitude, I can't say, you know, I am not frustrated or depressed. I really am. And since this particular issue happens, now I got to get all of my doctors involved. I have to make an appointment to see them to get an evaluation and get it clear that everything is okay before I go back and see the surgeon again to put me down on a waiting list. Now, the biggest problem is I'm trying to get these appointments with these doctors, and there's quite a few, at least 4 or 5 different doctors I got to get clear from. Everybody, as we all know, appointments with the doctors are pretty tough, pretty hard to come by these days, and the only way I can get in there as soon as possible is to see if they can accommodate me because of the unexpected cancellation of the surgery. Yeah, so I had to get in touch with you know, my primary, my cardiologist. I have to get reports. Also the pulmonologist, the anesthesiology department, as well as the you know, a liver doctor, just to make sure that everything is fine. It's pretty frustrating, I have to say. But you know, like I said, I'm still keeping a positive attitude. It is what it is, and I gotta coordinate all these doctors. I've been on the phone all morning, and after this video, I need to get back on the phone and call a couple more doctors to see if they can actually accommodate me. And I'm waiting for a couple doctors to get back to me, or a couple nurses to get back to me, because they need to check with the doctors if they can accommodate me. So yeah, it is unfortunate that I could not get through with my surgery. It was canceled unexpectedly. It's better to be safe than sorry. Definitely, I don't not wish anybody have to go through these hip surgeries, hip replacements, or any sort of major surgery. But unfortunately, you know, with ankylosing spondylitis and other types of rheumatoid, you know, scoliosis, all these autoimmune diseases, it's really damaging, and it's killing all of our tissues. And yeah, it's unfortunate. I have to go through it. I'm sure many people had as well, and hopefully the next time will be a success. So anyway, I want to thank everybody who wished me the who sent me prayers and gave me all these surgery wishes to get well. Thank you all, and we'll definitely see. I definitely will need to work out with all the doctors and get back on the waiting list and get this done. Oh, sorry. I want to talk about fentanyl. Yeah, I don't understand why fentanyl is really one of the highly wanted drug on the illegal market, but my God, even legally when I got it, this particular drug is, the effect is so bad that I was so drowsy. I was just not feeling well. I was feeling comfortable, but honestly, the sensation is not that great. And as far as I know, fentanyl, it's a really potent medication. It's stronger than oxycodone and morphine. Now oxy, which I don't really like a whole lot either. I think I only used it once and throughout my many surgeries, but morphine I used it a few times. But I don't have any choice, and I believe with a hospital setting is when you go on some kind of surgery, morphines and oxycodone is what they use for pain medication, of course in a controlled environment. So, but fentanyl is it's the first time I ever used it. I don't like the effect. I don't like the feeling of it. I got discharged yesterday, and I'm feeling very drowsy. It's been, right now it's probably more than 24 hours. It's about 30 hours into the times where I first took the medication until today. I'm still feeling a little bit off with these medications, but it's I'm a lot more awake, of course. So I honestly I don't know what the fuzz about people who wanted these drugs in the illegal market. It's just really bad, even on a controlled environment. So that's just my thoughts, and I know everybody, I can't understand these people out there who wants it. So, well, yeah, that's all I want to say about the medications. I will definitely keep you guys updated, and thank you for watching. See you in the next video. Thank you. Bye bye.